Okay. Welcome. My name is Jessica Vaith, and I am the clinical coordinator for the Masters of Arts in Counseling program at Colorado Christian University. I've probably interacted with most of you by now. Thank you so much for being here tonight. We are so grateful for all of you and all the work that you do as site supervisors. We really couldn't have a Masters of Arts in Counseling program without each and every one of you. This webinar is one of 2 webinars that we have each year for our site supervisors. And the purpose really behind having these free webinars was to be able to provide continued education for you as supervisors, but also we just wanted to give back something to you for your service to our students. Our next webinar will be announced later this year and will likely be scheduled for early 2019. I'm going to ask if you guys could go ahead and please mute your microphones for now. And then if you guys would also type your name in the chat box, that way I can collect attendance and I'll send you guys a certificate of attendance later on this week. Now I'm going to go ahead and introduce our speaker, Dr. Nichols, for the evening, and then I'll hand it over to her. Dr. Nichols has 14 years of clinical practice focusing on addictions, criminal conduct, and mental health issues. Dr. Nichols' dissertation research focused on the Supervisory Working Alliance within community corrections treatment programs. Additionally, she maintains a current private practice providing counseling and clinical supervision. Dr. Nichols strives to encourage, educate, and develop students to become competent and ethical counselors, as well as advocates in the field. She presented at the 2016 ACA conference in Montreal, Quebec, Canada, and presents at state conferences such as CCA and CAAP. Dr. Nichols has served on the executive committee of the Colorado Association of Addiction Professionals from 2012 to the present. Dr. Nichols is the recipient of the Colorado Counseling Association Outstanding Advocacy Award 2014-2015 in recognition of her leadership, advocacy, contributions, and sustained commitment to the community and CCA. And additionally, she has taught with CCU for 5 years. So we are so excited to have her tonight, and I'm going to go ahead and hand it over to you, Dr. Nichols.
Thank you, Jessica. That's a lot of Dr. Nichols this and Dr. Nichols that, but welcome everybody, and I want to extend my extreme appreciation to all of you for what you do for our interns. It's a lot of energy, it takes time, and it's just added work into your day, and we understand that. And so thank you so much for being willing to do that. One thing I want for you to understand is that I realize that we have a wide gamut of supervisory experience, training, and just time in the field with doing supervision with any kind of supervisee, whether it's an intern or a staff clinician. So I am going to be kind of doing a gunshot approach to every level of supervisor here. And I'm going to share my screen with you. And what we are going to, the title of it is Supervision Challenges, What Do We Do Now? The first thing I want to do is kind of lay a foundation, some definitions that'll help us all be on the same page for this particular webinar. So I'm going to kind of lay some groundwork, and then I have several case studies. My hope is that this will be a very interactive webinar. I would like all of you to chime in and give your opinions on the case studies. If you have an example or something that you would like to throw out there and talk about as far as a supervision challenge, I would really love to hear about that and to be able to discuss it and, you know, kind of how would everybody handle that. So I want this to be kind of a collaborative, almost a collegial type of support webinar for everyone. So let's get started with the basics. Get this, there we go. So the agenda, we're just going to briefly talk about code of ethics and standards of practice, some definitions that to kind of get us all on the same page. I'm going to talk about supervisor, but mostly, and most importantly for this webinar, the supervisee requirements that we need to instill in our supervisees, and then several case examples. And I will leave time at the end for questions. And that reminds me, I gotta look at my watch here so I don't go over. So there are several ethical codes and standards of practice that help us with supervision. What is acceptable in the field, what is considered to be good practices for supervision. Of course, the main one is the ACA 2014 Code of Ethics. They do speak to supervision and what our requirements are in providing supervision for any supervisee. And then there is the NADAC Code of Ethics, the 2016 new NADAC Code of Ethics that's been updated, and that's for addiction professionals. So I don't know how many of you work in the addiction field or with addictions, but they have a very specific section in it that deals specifically with supervision and what the requirements are. And it's more comprehensive than the ACA. It's more detailed. And then the ACES Best Practices in Supervision is all about supervision and how we are to conduct ourselves as supervisors, the type of services we are to provide to our supervisees, what's helpful, what's not helpful, and those kinds of things. So the ACES Best Practices in Supervision is really good. And then there's the SAMHSA TAP 21, which includes supervision. And what they feel is the standard that they adhere to for supervision in mental health and addiction counseling. So, and then you may be a licensed clinical social worker, a licensed marriage and family therapist. Every profession licensure has their own code of ethics. And so, of course, you want to look at your own code of ethics and go by whatever supervision they have. But these are other ones, and the more mainline ones for mental health and other areas of the field that you could go to as a reference. And I have an extensive reference at the end of the PowerPoint where you can look up all of this stuff. It's got the exact references where you can find all these resources. So I just wanted to provide them to you as an added, help for you in your supervision. So definitions, clinical supervision, what is it? So in my research, it's a senior clinician in the role and practice of providing work review and evaluation, skill improvement, impartation of advanced knowledge, protection for clients, and problem-solving support for a less seasoned or trained counselor. Now, with the work review and evaluation, we're not only talking about skills and how they work with clients, but also documentation. I think we all are aware that one of the main grievances in any state is lack of timely and accurate documentation, clinical documentation, whether it's notes, intake, treatment planning, whatever it is. And so that seems to be the second thing that sometimes supervisors look at when it really needs to be a primary thing as well as skills. Because if that foundation isn't there and the clinician or the intern does not have that correct, their treatment is going to be all over the place. So looking at that. Skill improvement, that goes without saying. We're always working on our interns' skill improvement. Impartation of advanced knowledge. So just you have more experience, you have more training, you have more knowledge about counseling than any intern and a lot of staff clinicians that you may be supervising. There are times that supervisors are put into place because of they just happen to be the senior person on staff at the time. They've had more time at the agency, but that doesn't necessarily mean they're well trained as a supervisor. Being a good clinician does not equate to being a good and effective supervisor. And so sometimes that kind of gets flipped upside down and it can cause tension at agencies. Protection for clients, that is number one. We have to protect the clients. And so unless we know what's going on with the intern and their clients, we have no way of doing that. We'll talk more about that when we get to the supervisee requirements. Problem-solving support, of course. We're going to help them work through any problems or struggles they're having until they learn to do it for themselves. So the clinical supervisor roles can look very differently from time to time. You can take on the role of a teacher, a sounding board, a mentor, evaluator, problem solver, and empowerer. So it just really morphs and depends on the situation and the person you're supervising, which role you're really in at the time. So clinical supervision, the function is monitoring and training of the supervisee, job satisfaction. And I want to speak just a minute on that. So in my research, I have found that job satisfaction is very, very closely related to the intern or the clinician's view of the support they are receiving from their clinical supervisor. And that doesn't mean you're not being supportive, but their perspective may be skewed, like some of our clients' perspective are skewed too. So if their view is that they don't feel supported, that needs to be something that you work on in supervision, because if they don't have the feeling of support or job satisfaction, if it's a staff person, you're going to have higher turnover rate in your agency or wherever you're working. Counselor wellness, absolutely. We want everybody to be well and healthy in order to better serve our clients. So relationship and intervention, so you're doing observation, evaluation, providing feedback, instruction, modeling, and mutual problem solving. And you're presenting yourself in a competent manner with ethical standards, legal prescriptions, and professional practices. Yeah, there we go. Quality supervision. So what's the difference between just supervision and quality supervision? Whoops, didn't mean for that to happen. I was trying to move the pictures out of the way here for me. So supervisors adhere to all the applicable ethical codes, standards, and best practices of supervision. The ones I provided to you at the beginning of the presentation are the main ones that I'm talking about here. Quality supervisors engage in supervision-specific training to hone their skills as a supervisor. They promote a strong supervisory working alliance or relationship between them and the supervisee. Multicultural awareness is brought up in supervision, and what is not a fun thing that I have noticed in my supervision is if I don't bring it up, they definitely don't bring it up. In the beginning, when I was supervising, I had one supervisee that it wasn't until the fourth supervisor session that I realized that the client was a different ethnicity and a very different background from the clinician. And the clinician was not including this or taking that into account in their work with the client. And it was adversely impacting the client. So I've learned the very first session, anytime a new client is brought to me, I cover the multicultural elements of that client so that I can help the supervisee take that into their account in how they're working with them. So multicultural awareness should be something that we are very focused on, because if we don't bring it up, the supervisee usually doesn't. Personal and professional development, so growing personally and professionally can look a lot of different ways, but it's good for us to keep moving forward as an individual. And advancing the counseling profession. So not only being aware of legislation that's happening in our own states that will impact how we do our job with our clients, but also giving our supervisees to be aware of this is important. You need to be looking at advocating for your clients. And part of that is looking at the laws that are may be passed in the state and how it's going to impact either for the better or for the detriment of the client. So just getting that kind of going with them and on their minds. Supervisory working alliance, like I said, it's the supervisor-supervisee relationship or professional bond. And that involves resulting actions of imparting knowledge and skills for the supervisee, personal and professional growth. So encouraging them not only to be maybe researching for the benefit of their client, but also to be getting their own help if they need it, or that they're doing good self-care, which we know is very hard to do when you're in a master's program and you're an intern. There's not much time for that. So what I mean by the Supervisory Working Alliance is that you have a horizontal, I've got a horizontal tutorial here of a supervisor supervising in the Supervisory Working Alliance. So the supervisor offers structured supervision, documentation, and honest feedback. The supervisee, needs to be engaged and needs to have vulnerability with you and compliance with your directives. That will result in a supervisory working alliance that will enhance client safety, effective treatment, and retention. I have included here some resources for sample documents for supervision, which include contracts for supervision. It could be any kind of progress documentation, things that may be helpful to you in working with supervisees. So those are just some resources that you could utilize. Other resources, of course, are your state regulatory agencies, professional organizations, their guidelines on supervision, and tools and tips to help with that, and also conferences and workshops that might have themes of supervision that would be helpful to you in the future. So the relationship, a supervisory relationship, needs to be professional, formal, hierarchical, I can never say that word, and evaluative. So even though we don't want it to be an authoritative, I rule you type of thing, I think we've all had bosses or supervisors from time to time that have been that way. And it really does not help with clinical growth in an intern or a staff counselor. So looking at how you can best meet that supervisee just like you best meet your clients in session. It extends over a specific length of time. For you, it's from semester to semester. You enhance professional growth, development, and functioning of the supervisee. You monitor the quality of the services provided by the supervisee to ensure proper care of the client and that there is no harm being done. And that's an ongoing gatekeeping responsibility, because after all, you're signing off for their clinical hours, and it's your license they're working under. So your license is at risk. So you want to make sure that you're also protecting yourself as well as protecting the client. You want to document everything to make sure that if something should happen and an intern should be grieved, that you have documented, just like we tell our interns, if you don't document it, it didn't happen. And your documentation is the only thing that's really going to protect you against a licensing board or something like that, saying that I did my due diligence as a supervisor. Here's what I directed them to do. The intern didn't follow it. That's not my fault. So you get what I mean. But please, 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 we are here as professors to support you. And unless we know when there's a problem, we can't help you and support you in that and work from our ends to bring that intern into alignment with maybe what they need to be doing or stop doing what they shouldn't be doing. So communication with your intern's professor for the practicum or internship semester. You should have gotten an email. You should be getting repeated emails every couple of weeks. You have their contact information. Please contact them if you have a concern, because then we can collaborate with you and join with you on solving the issue. You're not out there on your own. We want to collaborate with you and support you in this if there are issues or concerns. So please communicate with us. You are gatekeepers of addiction and all of the mental health counseling professions as the clinical supervisor. And Quality clinical supervisors uphold the highest standards of clinical service deliveries. They act as a role model, and you have awareness and respond to ethical concerns in a timely and prudent manner. So say you are aware that an intern makes a pretty big mistake and it impacted a client. You don't wait a week later to address that with them. Find a way to address that with them as soon as possible before they see the client again. And then hopefully you can work that out and have them correct their course on that. You teach principles of ethical decision making. We want our students learn the different types of ethical decision making models in their courses. So you can remind them, what's your ethical decision making model? And how do you work through this ethical decision on your own? And help them walk through that, or at least remind them of that. Give it to them as a weekend homework assignment. Tell them, I want you to go home over the weekend, work through your ethical decision-making model, and then email me what you come up with on a solution for this dilemma. We want to teach them to use this on their own rather than being handheld. You shouldn't be hand-holding, but you should be helping to push them and direct them. And we can help you with that also. So the goals of supervision are to promote professional and ethical growth and development of the supervisees, protect the welfare of the clients, of course, monitor the performance of the supervisees, and empower the supervisee to self-supervise. So kind of like with the ethical decision-making model, we want to teach them to reflect on their own work and really take it to heart and self-supervise themselves. They shouldn't be depending on you for everything or depending on us for everything as they get closer to the end of their program. Because once they graduate, even though they're still going to have supervision to sign off on their licensure hours, they really need to start building that confidence and in their own decision-making, their own clinical skills and discernment, and being able to stand a little more on their own 2 feet. So we do want to push them a little bit, right? So supervisor responsibilities are very similar to the supervisee responsibilities according to ACA, NADAC, ACES best practices, and SAMHSA. Supervision-specific training and experience should be gotten before beginning supervisor services for any supervisee. Many times we're thrown into that. I was thrown into it with no training whatsoever, and it was like sink or swim. And sometimes that works well, and sometimes it doesn't work well. But the more training and experience you can get in supervisor practices like this webinar is always helpful. It's just going to help you do better and know a little more what to do, or maybe even get consultation with somebody else with a real issue with supervising, like the professor or maybe your director of the program, whatever. Having knowledge of the supervisory models and the consent that is necessary with your supervisee. So you should have a supervisory contract with your supervisee that outlines the expectations you have for them when they come to supervision. We'll talk about that in a second. It's a gatekeeping function. Are you impaired as a supervisor? Is your supervisee impaired? That means mental health impairment. It means maybe substance use impairment. It means a physical problem that becomes an impairment. Maybe someone in their family that's close just passed away and they're really dealing with grief, and they're doing grief and loss counseling. Probably best for them to pull back from that until they get a little bit of help of their own. So what is that impairment, and is it impacting their ability to be effective with their clients is the main thing. And then adhering, of course, to the code of ethics and standards. So here's a case study, a scenario. So graduate school. You've been out of graduate school for 3 years and licensed for 1 year. An old friend and former classmate calls you to say that she just graduated from her master's program and she wants you to supervise her for her licensure for the next 2 years. Since she helped you study and reviewed your papers during graduate school, she wants to know if you can supervise her at a reduced rate or pro bono as a quid pro quo for those good old days. So what would be your response to this individual? Any ideas? And you can unmute yourself and chime in. What do you think? What would you do?
I would say no. I think it's a conflict, a huge conflict of interest.
And why would it be a conflict of interest? Can you identify that?
3 words, an old friend.
Okay. Okay.
Plus, I don't think the person's had enough experience, but
that's good point. That's very good point. Yes. What else?
I'm gonna mute and let someone else talk.
Okay. Thank you.
I agree with her. I think the old friend part, it's a hierarchical issue.
Yeah, it's highly unlikely that she can actually take the authoritative position if needed, right? So, yeah. What else?
I'm concerned that the one that's the supervisor has had enough experience. She's only been licensed for 1 year and she's supervising. That seems like a lack of experience to me.
Yeah, and there's probably not any supervision-specific training there either, right? So she's clueless. Maybe not.
Well, and you might consider that there would be a dual role there depending on what an old friend means and do the classmates still get back together and what that relationship looks like. For me, I don't ever charge for supervision, so the money piece doesn't, I guess it just depends on, what that might look like for everybody else.
Well, and I think that the money piece is a big issue because trading services, that can get a little dicey, especially if you are friends, who comes out on the other end of that as benefiting more, and that could definitely get in the way. I have heard of people who do trade. I personally am just able to supervise within my my agency, but I don't think it's that unusual to trade. Like for example, I've heard of people who trade rent for supervision. But I think that the boundary issue is the friendship.
Okay. Anybody else?
We have some things in the chat as well. People are saying dual relationship, and the question from her friend was inappropriate given she already understood dual relationship from her training.
Ooh, good.
We also have quid pro quo is used when someone expects you'll let them slide. And supervisee does not set the rate.
Okay. One thing I kind of got from this was a flavor of pressure. I helped you study and review your papers during graduate school. So you owe me. I kind of got that flavor from it, and I'm reading into it, and we're all kind of reading into it because it's just a scenario, but that's something to look at as far as, healthy boundaries and appropriate boundaries in supervision, supervisee relationships. So let's move on here to the supervising responsibilities, and then we'll go to the other case studies. So the same codes, the same standards, they have to adhere to those also, and they have the same obligations as a professional licensed counselor. They just do. They have to follow all the state laws, all the rules, do no harm. Everything is the same. Just because they're an intern or a supervisee doesn't mean that they don't have to adhere to the level that you do. It just means that they may be learning what that level is, and you're helping them along to instill that in them. Disclosure. So the limits of confidentiality with their clients, they have to tell the clients who their supervisor is and contact information of some sort for you as a supervisor. because the client has the right to go to you if they have a problem with the intern. So they have a right to that information with an intern, and they need to disclose that, and they need to disclose that they are an intern. The client has rights to know that. And they need to learn to self-monitor themselves for impairment and seek appropriate services if needed. If they need their own counseling over an issue that's being triggered with a client, they need to go get that. I don't care how busy they are, how much homework they have, how much internship is going on. An hour a week, they need to be seeking their own services with a counselor if needed. So their responsibilities are also, ignorance is not a defense. Just because they didn't know is not the defense for making mistakes. So they need to be in charge of their own learning, as we'll see here in a minute. They need to follow your directions. Unless you're asking them to do something illegal or unethical, they need to follow your directions. They need to be humble and respectful about that. And they need to follow state statutes, ethical codes, facility policies, and procedures. They just have to. So that is a standard that we really want to hold good boundaries on with interns. They need to be open and honest with you in communication and supervision, because if they're not, you do not know what's happening between them and their client. How can you protect the client and help the intern grow? Also, this is a huge area when you have boundary crossing issues where counselors become inappropriately involved with their clients. This is where it begins. As long as there's a secret, that secret grows in power, and that slippery slope happens. So if we can get our interns to be open and honest with any feelings they have about their clients, or maybe their clients have divulged to them that they're getting feelings about their intern, that needs to be discussed in supervision to diffuse the situation and normalize it to an extent, because things do happen. But it doesn't have to get out of control. No one has to act on it, and that's what we want to stop. Documentation needs to be accurate and timely. Now, there isn't really a good standard, at least in the state of Colorado, for what is timely clinical notes. So I prefer to have them done before I go home that day. Sometimes that isn't doable. You have to finish them up the next day, or at least before you go home for your weekend, whenever that is. But if you're in an agency, the agency may have certain standards, and the intern needs to know what that timeliness means in your agency, and they need to abide by that. They need to take accountability for their own learning. You can't spoon feed them everything, but you can give them resources, and then they need to follow up on those resources to find out the information they need to be of best value to their clients and to grow personally and professionally. And they have to keep you in the loop. You don't know, and you can't help if they don't let you know what's going on. You don't need to know every detail, but common sense. And if they're holding back something, that's because something needs to be addressed. And so that vulnerability piece, it needs to come in. They need to arrive to your supervision sessions prepared with questions, concerns, and confusion that they may have. It's horrible to sit there and say, so how was your week and how's it going with your clients? Great, I have no problems. Oh, that's not true. There are things to discuss. You are learning. You are not a seasoned clinician. And so they need to come prepared. And so sometimes I will give supervisors who struggle with that a template of what they need to fill out and think about before they come to supervision each week. So there's very structured supervision on what we cover, so nothing is missed. Consultation with peers and other professionals is great, especially after they graduate. However, I would be very cautious if they are seeking consultation with peers at your site, because it may be another intern where it's the blind leading the blind. Neither one knows more than the other one. And so they ask each other, what would you do? Well, that may not necessarily be the best thing. So instilling with them, it's okay to talk to others, but it does not take the place of the supervision every week with you or with their professor. They need to be researching the latest academic and scholarly resources. We drill that home in our program. That means you do not search things on Wikipedia or watch YouTube videos and expect that that's that's the standard and that's what it is. And they need to be looking at the latest research and talking to you about your experiences and your professional expertise. They need to be attending professional conferences, and we ask them to do that so they can learn about the different areas of the field, the resources that are available, and start to network as a professional. And they need to belong to quality professional organizations. The very first course they take in our program, they have to join the American Counseling Association as a student member. And we encourage them to use that resource to pull up their scholarly peer-reviewed articles, to learn the newest and greatest things in the field. And so they already have that going. And you can always turn them back to that. If they're asking you certain questions, we'll have you check the ACA website for resources or articles on that. You can always do that for them. So another case, internship. A graduate student at a local agency has been passive-aggressive and resisting clinical supervision. She has missed a total of 5 hours of individual supervision and 6 hours of group supervision in a 9-month internship because of illness, forgetting, or class break. The intern is now very remorseful about her missed supervision time and wants the agency to sign off on her internship paperwork so she can graduate from her master's program in 2 weeks. What do you think?
My favorite 2 words, oh well. Absolutely not. Absolutely not.
What would anybody else say to this intern?
I actually went through something similar with an intern, but she was not actually remorseful. In fact, she wanted me to sign off, and I had been pretty, I had documented the fact that there had been so much supervision time lost, and over the month of December, I had actually offered to, I had done everything I could to help her catch up, and I had been talking with her faculty advisor about this, and we could have made up the missed time, but she was going on vacation, and so I had gotten approval to even FaceTime her, and still didn't want to do that. So yes, as Sally said, oh well, I don't know what else I could do, but yeah, I was very perplexed as to there was no sense of urgency, and in that case, yeah, you haven't fulfilled what you're supposed to do, and there's nothing I can do about it. So it's unfortunate, but
you absolutely went above and beyond for this individual, which you did not have to do and don't need to do. And this, when I see individuals doing this sort of thing, I always ask them, how badly do you really want to be a licensed professional? How badly do you want to graduate because your behavior is not matching what you're saying? And how do you handle your clients when they have that incongruence? So I just kind of turn it back on them. But absolutely, there is no motivation going on there or priority. If it were me, I would have canceled vacation. So yeah.
I agree. I think some 2 really important things though that as a supervisor is that communication back to like the school or whoever, so the 9 months or 6 months aren't over with, and the school hasn't heard about this, so that communication. And I think the other piece is that documentation to show that, like we had all these opportunities, they no-showed, they didn't come, that type of thing.
Yes.
Yeah, this has happened several times to me too, though.
What's good about CCU and the time to track that we're using now, we're able to watch and see how they're doing with their supervision hours. So as long as you're approving those supervision hours, saying that you actually did them with them, that's our cue that things are on track. Otherwise, we need to hear about it for sure. Go ahead. I'm sorry. I didn't mean to interrupt whoever was going to talk.
What I was going to say, can you hear me?
Yes.
Okay. What I was going to say is I think this should have been addressed earlier on, and that honestly, if I had a supervisee that had missed at 2 or 3 supervision sessions, I would probably not be giving them any more clients to see also, because
good point.
because I wouldn't know what was going on with their clients, and then also they wouldn't be benefiting from the supervisory relationship. So to me, right, I would say after 2 or 3 missed supervisory sessions, I probably would not be giving this person any more clients too. So that would also not be
Beautiful.
meeting their requirements.
Absolutely. That's a great, yeah, because you need to know what's going on, and you don't know what they're doing with their clients. I mean, holy cow.
Exactly.
Scary. Anything else on this one?
The situation that I've been experiencing is that I have gotten some feedback, not through CCU, but a different school, from that school's supervisor as well as my clinical, I guess, boss, is that being a supervisor is more than just giving feedback on their cases. It's teaching them how to be a professional in this realm. It's teaching them how to be a professional therapist. And so if this was a job, this is not behavior that's tolerable.
They wouldn't have a job.
Right.
Right.
So giving them that feedback too.
Yes. And there are some interns that don't take it as seriously as they should. And so that really, I like impressing that on them. And otherwise, they're not going to make it. If they graduate, they're not going to be able to hold a job long. They're going to be in trouble. So just the reality, I think, sometimes needs to come up and slap them a little bit and wake them up. I don't know. So let's move to the next one, which is clinical documentation. A clinical supervisor at an internship site discovers that an intern has fallen behind in required clinical documentation. 2 of the client's intake assessments are not complete, yet the intern has met with these clients for 6 sessions apiece. Additionally, the intern is at least 2 weeks behind in all client session notes, and the notes that are complete do not relate in any way to the documented treatment plan. What do you think?
First of all, I don't know. At my age, if I don't do it that night, I'm not going to remember session to session. There is no way anybody can go back and make that up. And it should have been caught a lot sooner than that. But to me, I don't know if we can write them up for stuff, but that's definitely a no-no. That's a definite violation.
Okay.
Yeah, this is an intern, right? This is Franklin Swain.
Yes.
Sorry, my camera has me showing up upside down, so I'm not on video, but this is an intern, right?
Yes, it is.
Okay, thanks. Because I did this with an active duty social worker, so they lost their license.
Oh, yeah.
Absolutely.
Oh, yeah.
And then we had to go back and meet with each of those clients to determine had they been harmed by this individual, only because there was no documentation to indicate what had truly happened in the sessions.
Yeah.
So mine is immediately remove them from care, and then notify each client of your intent to speak with them and offer them a new provider. Not about showing the dirty laundry, but just that the provider is no longer available, and clean that up. And then I would ask CCU on this one, but I would consider their career over before it started, but I would let you guys make the decision. I just think that this is horrible.
Yeah, I love that. I love that approach. It is all about client care and protection. And I think they would need to be removed, at least for the time being. And just take a look at it. It needs to be a collaborative look at what's going on. Yeah. Because we all know that some sites, especially particular sites and particular populations, if the notes aren't done before you go home that night and an emergency happens in the evening, you're toast. And that client is not going to have good care because nobody's going to know what happened in that session. And, so it just is too grave. And I'm with Sally. My memory at my age, I've got to do them before I go home, or it's all going to run together. So I try to do it at between sessions. I leave enough time in between. But at some agencies, you don't have maybe quite enough time, and you have to catch up at the end of the day. So, yeah. Any other thoughts on that? Okay. Countertransference. An intern is having a difficult time connecting with adolescent clients during live supervision observation. So you're doing live supervision observation with them. When brought up in supervision, the intern reveals for the first time that she was sexually abused as an adolescent and has countertransference issues with girls during counseling. What are your recommendations for this intern?
Definitely, I would have. There needs to be an intervention because she doesn't need to be seeing that client. And so how you would go about, just like what the guy said earlier, talk to the client about referring them to another counselor, and just put an end to it as soon as is not going to harm the child, but stop it.
What would you recommend for the intern? Anything?
She probably needs some counseling on her own outside to deal with that, because that is a huge, huge flag for a counselor.
And maybe they don't need to be working with adolescent clients.
That's what I was going to suggest. One of the things that I talk to my interns about pretty regularly is where they are right now with what their interests are. Because a lot of people go into their master's program or go into their internship, oh, I want to work with families, or, oh, I want to work with couples, or whatever it is. And they change as time goes on based on maybe how they're triggered or how much they enjoy it. And so in addition to, of course, I think the counseling would be very important, is maybe just ask them, after you go through some therapy yourself, maybe you want to revisit the idea of whether or not you want to work with children. It may just be an ongoing problem, even if she is getting something. So,
yeah, adjust the population you work with to be more effective. Just because we have a heart or a passion for an area doesn't mean we're healthy enough to work with those individuals. So yes, all of us have our areas that are a little difficult than others, and that's part of the learning process with internship and even after graduation. You find out, hey, this isn't at all what I thought it was, and I don't ever want to work with couples again, type of thing. So very good.
I really like this example because that kind of on face value, right? An intern is having a difficult time with an adolescent client. But then in supervision, it's brought up, hey, what's going on? I noticed that you're having a difficult time or something. And then it is revealed in the supervision process about the countertransference issues. So this is to me, a really good example of how we can be effective as supervisors and kind of helping a supervisee recognize kind of what is happening in their resistance in the therapy session. And
yes,
it's a great example.
And it happens.
It absolutely happens. So I think and what is important about this is the ability for a supervisee to notice that and be able to communicate that in a supervision session, and then also for supervisee to feel vulnerable enough to be able to communicate that to supervision session. So it's kind of going back to what you were talking about in terms of the importance of the relationship.
Yeah, the supportive and safety of being able to be vulnerable, just like with our clients. You know, we're not going to be their counselor, but, you know, for them to feel safe enough to be vulnerable with us so that we can help guide them in the direction they need to go. Okay? Absolutely. Okay, ethics and boundaries. So a female intern has had a pattern of arriving to the residential site in short skirts and low-cut blouses. Another staff member brings to your attention that the intern has been having more than one weekly session with a male client. What is your response to the intern in your supervision session?
You have to address this. This has to be addressed because that's too provocative to deal with any. I don't even know what the male client's issues are, but that's just way too provocative. And that's just not professional. You cannot go out looking like a hoe. You know what I'm saying?
Well, and I think they could be two different issues, because you could have somebody who is wearing, you know, the short skirts and the low cut blouses and not be having extra sessions, and it still would be inappropriate. And so I would refer them back to like we have a dress code, and talking about how, you know, that there's a reason for the dress code, that we want to be professional. You know, we don't want them to feel, you know, or, you know, like sometimes, you know, you could put it back on them and say you know, we don't want other people to be looking at you and looking at you that way. We want them to be looking at you as professional. It's distracting the client, you know, those kinds of things. And so I think they can be two separate issues, because even if they're dressing perfectly professional, but they are kind of crossing the boundary and having too many sessions or being favorable to a client, you have to address that as well.
Absolutely.
Well, and just, are you treating every patient equally? If you're choosing one patient to meet with more frequently, is it because he has more intense needs, or is it because there's an unequal treatment across the board for some reason?
Good point. Yeah, it may be, you know, they may be in a very vulnerable state, having suicidal ideation, cutting quite regularly, and you want to move up their sessions and have more frequent sessions with them for a time being to stabilize them, because like I said, this is in a residential site, so they're there all the time. But once again, is this a separate problem, or is this connected together? And they may be dressed normally for their family standards or the friends they hang out with, all of that. But if they're being distracting to their clients being able to do therapeutic sessions, then whatever the distraction is, it needs to be removed. And dress can just be one of them. It could be perfumes. It could be an open window with a lot of people walking by. It can be all kinds of things that could distract the client that needs to be adjusted, not just the dress. But I've had several interns that we've, you know, had this discussion about dress. And sometimes there's been a few times that I've done what Sally has, and I've been very plain, you know, you're not going to the clubs and you can't go out like you're trying to find a date. That's just inappropriate, and it doesn't work in this profession. So you need to dress more modestly and professionally, nothing really tight, you know, those kinds of things. And, you know, some of the younger individuals, it takes more than one talking to for them to understand what you're talking about, because it is normal for their environment that they live in or whatever. So, yeah. Scope of practice. So in group supervision, an intern discusses how he shares with his depressed clients which antidepressants are the worst to take, and that he personally does not believe in taking medications. What is your response to this intern in supervision session?
I would just say, first of all, we are not medical doctors. We cannot give advice like that. It is entirely inappropriate, and it is outside of your scope. So I definitely would reprimand that.
Okay. So that would be a definite direction you would be giving them that you intend them to follow at all. It's not a suggestion. You might try. This is a directive, right? That's what you're saying, Kelly.
I think also he's kind of going into that whole personal disclosure element. And, I think with interns, when I've spoken with mine about disclosure, we've kind of practiced examples of what is therapeutically helpful, but to be very, very careful about talking about my own personal life. And I think saying that he personally does not believe in taking medications, that would open the door maybe to them thinking, well, are you depressed too? And I think that would be a really dicey thing to get into.
It might even cause the client to feel judged or shamed because they thought about taking medications. Because why did the discussion come up with to begin with? We just don't know. Anything else? Yeah, practicing medicine without a license. Practicing law without a license. Yeah. Got to keep our little ducks in a row and make sure they're practicing within their scope. Clinical hours. One of the supervisors quit last month and took a job in another state. Several of the interns mentioned in staffing that the supervisor left without signing off on their supervised clinical practice hours. The interns have asked another supervisor who has the same credentials to sign off on the hours for them. What are your thoughts?
I think I would at least try to track down the supervisor and get her to sign it. I mean, she obviously left an address because you can't sign off on another supervisor. You don't know. You don't know if they've done it.
Exactly. So you would help the interns track that person down and try to get them to respond. Okay. What else?
I actually ran into something similar to this where I had an intern who was also working on her CAC.
Okay.
And apparently the program that she was in ended or whatever was going on. She needed somebody to sign off on that, and I'm not a CAC. I can't do that. And so that would, led her to have to hunt this person down. But in a different way, it was the same thing. I had different credentials, and I certainly couldn't sign off on that. But it still is that dilemma of this person has put in the work, put in the time, but they've been left in the lurch, unfortunately.
Mm-hmm. Mm-hmm. Okay, so in conclusion, the ethical codes and standards of practice are for both us and the supervisee, of course. The supervisory working alliance is really important for them to be open and vulnerable with us, so looking at that. Quality supervision requires some kind of training, awareness, and investment on our parts as supervisors. And supervision doesn't need to be haphazard or a barrier to client treatment and effectiveness. We need to determine what's a good structure for us that we're going to hold with each supervisee, and so they understand what their responsibilities are and then hold them to that. And remember that you have support at CCU with the professors, with the clinical coordinator, Jessica Faith. You have us to talk to. Just shoot us an email, call us, whatever. We're here to help support you and to help you work through dilemmas or to hold the interns accountable on our end. But with this, I want to open it up for questions or any kind of scenario that you would like to share before we end. We're kind of coming to the end of our time, but we have a couple of minutes. And I have provided my CCU email here as well as my private practice email and phone number. If you ever want to call me or contact me with a question, that's fine.
Thank you.
Well, thank you very much for the engagement. This has been great, listening to your ideas and how you would respond to things. And I hope that I got across that, you know, we are a team with you in the practicum internship semesters with the interns. We're here to support you. And we expect the supervisees to do their due diligence and be good supervisees. It's not about, you know, being entitled or feeling like something's owed to them. They need to be humble, and they need to work in collaboration, and they need to be respectful and honor your direction and what you're giving them to do or research or whatever. And so any way that we can help you with that, we will be happy to do that. Thank you very much for your participation. This has been wonderful. Thank you.
Thank you, everybody. And make sure you go ahead and type your full name in the chat so I can get you guys your certificate of attendance. And I did record this, so I will send this out to all site supervisors. So if you're wanting to review that PowerPoint again, I will be sending that out. Thank you. Have a great night.